Oh, when a burn injury occurs, prompt and appropriate treatment is crucial to minimize damage, reduce pain, and even prevent infection. This segment will guide you through the essential steps for treating thermal burns, covering everything from immediate first aid to when professional medical attention is necessary. Joining us today, we have Emily Rose and Maria Mejia with St. John's Ambulance. Good morning to you both.
Hi, good morning.
I think it's really important too, because even for myself, I've been confused over the years about when you get a burn, how severe is it? How do you dictate the levels of which burn it is and go from there? I think that's a really great starting point.
Okay.
So there's a few different things that you can do to determine the severity and characteristics of a burn. Things like the depth is very important. So we have superficial burns, burns that penetrate the first two skin layers, which are considered to be moderate burns, and then full thickness burns, which penetrate all skin layers right down to sometimes the bone. So those, depending on the percentage of the body burned, would be considered critical burns. And then there's other things that go into determining the severity of the burn, things like the percentage of the body burned, which is very important. And we kind of use different scales for adults and children because obviously children are different sized. Location of the burn is also very important. So up on the screen right now is a very important diagram that we use to determine percentage of body burned. This is called the rule of nines diagram. And as you can see, it separates the body into different percentage segments. So we use that to locate the burn on the body and then determine how much of the body has been burned. So that's an anatomical male and female diagram. And I think we have one for children as well. So that's the other side of the adult diagram there.
And it's so great too, right? Because you see right there, like there's a perfect example, like with the colors and the percentage, like how important it is or how severe it's going to be.
Exactly. So just to your point there, when you look at the color scheme of this, any burns to the face or that may impact the airway are considered critical burns. It's very important to recognize and treat those burns early because they can cause things like airway compromise or respiratory failure.
Something obviously we want to avoid at all costs. And I think it's so important too. Even if at any point, if you're concerned and you've got some pain, go see somebody and do that.
Yes.
But we're actually going to do a little bit of a demo of an assessment right here. So, and I love that because I need this myself. So let's run through it. What do you guys have for us today?
Amazing. Okay, so to be able to treat a thermal burn specifically, we're going to be using some non-adherent pads. Obviously, always our PPE or personal protective equipment. So I got some gloves here for us, and then a bandage to kind of hold everything in place. So if you want to grab the gloves and just start putting those on, well, we'll walk you through how to do the skill on Emily. So we're gonna pretend that Emily here has a burn to both of her forearms.
Okay, both forearms, and thank goodness this is just a demo because there's way too much responsibility for me.
Perfect. So the first thing that we're going to want to do is assess what's going on, right? Once we remove the person from the source of the heat, we're going to assess what's going on. We're going to see how deep the burn is, all of that, and we're going to make sure that Emily here is breathing properly and that she's alert and awake and she seems okay. Once we assess these things, then we're going to start grabbing our equipment. So here we have our non-adherent pads. You're welcome to open this. As you can see, these are lynch-free and they don't stick to the skin that easily. Okay. So this is why we're going to be using this. Before we do anything else, we're going to make sure that to always remove any and all jewelry. Not going to make Emily here take all of her jewelry, but normally because of swelling, you're going to want to remove that. Okay. I'm going to check circulation by squeezing the finger and seeing how quickly the color comes back to the tip of the finger.
And what are you looking for in that case?
To make sure that the blood is coming back to the tip of the finger in less than 2 seconds. Okay. Anything outside of that, we're probably going to want to call 911.
Got it.
Perfect. So the next thing we're going to do is we're going to cover the wound with this non-adherent dressing. Oh, I'm so silly. We're going to want to cool down the wound by flushing with water that is room temperature, water that is as clean as possible, or water that you would drink for at least 10 minutes to cool down the wound. Got it. Then we're going to then put the non-adherent dressing, and we're going to want to hold this lightly in place, but with a roller gauze. So we want to open these. Perfect. So we're going to be opening these roller gauzes, and we're going to very gently wrap it around and hold it in place.
I'm going to save you.
Thank you.
There you go. Make sure it's not too tight, Will. You're going to want to make it nice and loose. Perfect. And so once it is nice and covered, we're going to want to tuck this just under here to keep it in place. And depending on the precautions that Emily spoke about, we're going to want to call 911, or maybe this is something that we can treat after.
Amazing. And if people are looking for more information on demonstrations like this or where to act, where should they head to? Because I think this is really vital information.
Yeah, great question. So if you go into sja.ca, that is our website. You can then go take any of our first aid classes, or basic first aid or intermediate first aid are our most popular courses that you can take to learn how to do this.
Amazing. Well, we really appreciate your time this morning. And now I have done my first official wrapping.
Good job. That was really good.
Look at that. I really appreciate on part of our Fire Safety Week. So again, thanks for coming in this morning. And again, we directed people there in case they have any more information. Really appreciate it.
Yes, thank you.